Okay, so again, your upper extremities, and we're going to start off with the bones. So in the upper extremity bones, we have the scapula and the clavicle, but we already talked about those. Okay, so we are going to go ahead and start with the humerus. We'll talk a little bit about the radius and ulna, the carpal and metacarpal bones, and the phalanges. Good thing is that for example, your carpals and metacarpals, they do have like individual names, but you guys are not responsible for knowing those names. You just have to know like these bones collectively are known as the carpals, these are the metacarpals, and so on. So we'll start off with the humerus. And can everybody see the cursor while it's moving? So this is supposedly the cursor that is shared with everybody, correct? Yes? Okay, perfect. Thank you. So we know that the humerus is a long bone, and they've got these epiphyses, which are the ends of the long bone. So there's a proximal one, and this one is the one up here, and that becomes part of your shoulder. And this one down here, that is the distal epiphysis, and that will become part or articulate with the radius and ulna to make your elbow joint. Well, there's a shaft of the humerus, and then there's the part in the middle that combines these two parts, the epiphysis and the shaft. This used to be the growth plate, okay, if this was a kid still growing, and then that growth plate becomes totally ossified, so it totally changes into bone and becomes known as the metaphysis. Okay, so your metaphysis is just ossified growth plate. Okay, I'm kind of going through a couple of things. If they're not on your list, you could just totally ignore what I'm saying and just focus on, you know, the stuff that's on your lab list. So for the proximal epiphysis, we've got the head of the humerus. And remember we said that the shoulder joint is a ball and socket joint where we have this little ball of the head of the humerus that articulates with part of the scapula. Does anybody remember which part of the scapula it articulates with? And you can look back into your notes. If you get it right, I will skip you on the quiz. So 3 seconds. 1, 2. No takers? Can I ask again? Okay. So the head of the humerus articulates with a certain part on the scapula. What is the name of that part? Yes, go ahead.
Is it the glenoid fossa?
It is. Yep, it's the glenoid cavity. Okay, so let me write down. I'm sorry.
Ooh. Do I get the 5 points already?
But you still have to stay, okay?
Fine.
I'm just fine, I know.
I'll stay. I like this class.
I'm sorry, I'm making your life so difficult. Okay, so I'm just writing your name down. And, okay, so yes, the head of the humerus articulates with the glenoid cavity of the scapula. And remember we said that the shoulder joint was one of the most weakest joints, but it is strengthened with a lot of structures. So you've got the fibrous capsule of the joint, you've got the tendons, the ligaments, you know, just a whole bunch of other structures that strengthen your shoulder joint, but it can be very easily dislocated if anything, especially from, you know, if it's hit from the upper part, an inferior or a lower dislocation is very easy to happen because there really aren't a lot of structures on the inferior surface of the joint that are supporting the joint. Okay, after the head, just like any head, there's a neck. Okay, so the humerus actually has 2 necks. There's an anatomical neck, which means that it is anatomically right underneath the head, just like our neck is anatomically underneath our head. So the head and then the anatomical neck, and then we have these 2 tubercles. Tubercles are basically just bumps, and bumps tend to happen in bones because of either muscle attachments or because of movements. So mostly bones are usually just this smooth surface, and then as muscles attach to them and have either origins or insertions in certain parts of the bone, due to the muscle activity, the bone will change its shape a little bit, and we get now these tubercles or a tuberosity, which we'll talk about in a minute. We've got 2 tubercles. There's a greater and a lesser tubercle. So when you're looking at them, one of them is medial and one is lateral. Besides the side of the tubercles, you want to know which one is medial and which one is lateral. So your greater tubercle, is that lateral or medial? Looking at this bone right here, would the greater tubercle be lateral or medial? So it is lateral. Tola, did you have a question or were you going to answer?
Oh no, I was gonna answer, but I realized my mic was set up wrong.
Okay, that's fine. So yeah, we want everybody to join us here too. So when we're in lab in person, which is very ironic because in lab everybody would be wearing a mask because of the odor. Okay, and I wouldn't be able to. We would be able to talk one-on-one. Okay, and it'll be a very interactive session, but I wouldn't be seeing your faces. So now that we're online, I still can't see most of your faces unless you have a picture up there or your video's up. And I've lost that interaction, unfortunately. So the interaction part makes it more fun. Okay, we all have to be here, so might as well enjoy the ride. It is also really important it helps in the learning process. So when you answer, even if you get it wrong, that's totally fine. I'd rather you get it wrong now while we're together instead of getting it wrong on a quiz or on a test. So just please, unmute yourself, go ahead, type in your answers, whatever you want. If you're not comfortable speaking, unmuting and speaking, you want to type in, that's fine too. I just want to make sure that everybody is interacting, and is learning as well. So we have these two tubercles. Okay, again, our greater tubercle is lateral, as you guys mentioned. The lesser tubercle is medial, and you could tell from the head. Okay, so the head is towards the body, towards the shoulder, in order to articulate with the scapula. So that would definitely be your medial side, and that's your lateral side. And then there's a groove in the middle, and the groove is known as the inner tubercular groove, or the bicipital groove, or the bicipital sulcus. So you're going to see these three terms being used interchangeably, and they're the same structure. So don't think that you're learning different things every time one of these come up. So again, your inner tubercular groove, inner tubercular sulcus, a bicipital sulcus and bicipital groove are all the same thing. And it's called the bicipital groove because there's a tendon of one of the heads of the biceps muscle that passes right into that groove. That's why we have the groove. It's made by the tendon of one of the heads of biceps. Now, when you go a little bit down on the on the shaft of the humerus, this is the anterior surface. So I believe the posterior surface is on another slide. We have a deltoid tuberosity. So from the name of the tuberosity, what do you think is inserted? Which muscle is inserted and causes that tuberosity?
Is it the lateral deltoid?
The whole deltoid, all of it. So all of the deltoid fibers converge together, or is it diverge? Gather together, whatever the word is. Okay, so they gather together and they insert into that deltoid tuberosity. Okay, so hence that's where the name comes from. And then if you go all the way down, further down, you can see now the distal epiphysis where we have different structures. And this is what I added. I added these two to kind of show how they articulate with the radius and ulna. So right here, that is known as the capitulum, and that is known as the trochlea. And these two process sides, this is the medial epicondyle, and that is the lateral epicondyle. And again, you would know lateral from medial, whichever picture that you're looking at. So if you get this image, you can tell medial from lateral by looking at the head of the humerus. Okay, so remember the head is medial, so this would be your medial epicondyle. Or if you're just looking at this view, well, this right here is the radius with its little tiny coin-shaped head, and that would be the ulna. So the radius is the radial or the lateral bone of the forearm, and the ulna is the medial bone of the forearm. So this would be your lateral epicondyle, and that is your medial epicondyle. Okay, so again, just a little trick when you're answering questions is to not just focus on what you're being asked about. You have to look at the bigger picture to orient yourself as where on earth am I in the body? Where is superior from inferior, and so on. Okay, so we've got the capitulum and the trochlea, and those are going to articulate with different parts of the radius and ulna in order to make your elbow joint. So the capitulum articulates with the head of the humerus, and the trochlea articulates with the trochlear notch of the ulna. The trochlear notch is this notch right here, that little curve. So the ulna has the top, or the proximal epiphysis of the ulna looks like it's C-shaped, and that groove in the middle is known as the trochlear notch. And it really works as a hinge. So the door hinges, that's exactly kind of what it looks like. When we flex and extend the elbow, we are really moving that joint right here, where the trochlear notch is gliding against that trochlea. Okay, so are we good on the parts? Because I know that's on your, it's on your lab list to know like which parts articulate with what other parts of bone. So are we good on these 2 points? Because there are more joints here.
I had a question on the capitulum and the trochlea, like based off of that photo in the middle. Is it saying the capitulum is the same as the lateral epicondyle and the trochlea is the same as the medial epicondyle, or are they separate?
No, they're separate. Okay, so the lateral epicondyle are these 2 bulges on the sides, and you can actually feel them on your arm. So if you kind of go all the way down on the shaft of the humerus and then you reach the end of the humerus, you can feel those 2 epicondyles on the sides. The capitulum and trochlea are all the way in the end. Those are the tips of the bone. So they're definitely different items, different structures.
Okay, and the capitulum and the trochlea are what connect to the radius and the ulna.
Correct. So the capitulum articulates with the ulna, with the radius, with the head of the radius, and the trochlea articulates with the trochlear notch of the ulna. Okay, you can see it here. Sorry, were you asking us something else, or are you good?
No, I'm good. Thank you.
You're good? Okay. You can also see it here. Unfortunately, though, this is like a very flat picture, so it's not 3D. But the head of the radius right here is articulating with the capitulum, and then the trochlear notch is articulating with the trochlea. But there's obviously, we've lost that through the depth of the picture, so you can't see which one is really articulating with which unless you look at it from an anterior view. So I think that covers everything on the anterior part. Okay, so there are movements and other articulations that are occurring in this area. So there are articulations between the radius and the ulna, and they really articulate together at 3 different points, and we'll take a look at them in other slides, not this one. Okay, I think the next one, is the posterior view of the humerus. And you know that you're in the back because you are seeing this olecranon and fossa, that that cavity in the back. The olecranon fossa is where this, and I'm just going to keep on going back and forth here, that process of the ulna, the olecranon process, inserts into. That's where it will kind of, dive in when we extend the elbow. So with my elbow extended, my olecranon process right now will be right in that cavity known as the olecranon fossa. And it's good that they share the same name. At least they share the first name. Okay, so are we good on that articulation?
Yeah.
Okay, so again, is this showing? Yeah. So the C-shaped part of the ulna, we've got, your olecranon notch. Where did it go? Where's the picture? So we're looking at it actually. Okay, olecranon process, and then the process on the bottom right here, that is your coronoid process, and then the trochlear notch, where which is the hinge-like movement. Okay, I was trying to look for something to remember because one of the common mistakes would be to confuse the olecranon with the coronoid process, And I couldn't find anything, to be honest. It's just OC. Well, so whatever OC would stand for, like I don't know, like yesterday's section, they came up with what? Operational something? I don't even remember. But so anyway, the one on top is the O, the one on the bottom is the C. If anybody can come up with a G-rated thing to remember, to help us remember what they are, what they stand for, that would be great. Okay. Oops, I was just about to raise my hand. Another posterior surface of the humerus is the radial groove. Okay, the radial groove has two structures. It's kind of like a little, well, it's not a tunnel because it's not covered, so there's no roof to that tunnel, but it's just a groove that is made due to the passage of a nerve and an artery. So did you guys listen to the lecture, or is that lecture not made yet?
No, that lecture was made.
Okay, so did you listen to it or not?
Yeah, like for the lecture portion, it's more of just a rundown of all of like the structures. There's not a lot of like discussion, I guess.
Okay, so the radial groove again is made due to the passage of a nerve and an artery. The nerve is the nerve of the posterior aspect of the arm and forearm, and that would be your radial nerve. And it's nice that the groove is named after the nerve. Okay, there's another structure that runs there, and that is an artery, and that is known as the deep brachial artery or the profunda brachii artery. So remember when we were talking about the brachial artery last week, we said that a branch needs to go to the back in order to supply the posterior, the muscles and the skin of the back of the arm and forearm, and we called it the deep brachial artery because it goes deeper into the arm. And those two structures run on that groove, okay? They are the ones actually causing that groove. So again, your radial groove has the radial nerve and the deep brachial or the profunda brachii artery. Okay, any questions, folks, or are we good? Everybody's good, even the quiet folks here?
Yeah, I think we're good.
Okay, everybody's good? Okay, perfect. Okay, thank you guys for answering. That really helps. Thanks. Okay, so now down to the radius and ulna. And we kind of already talked about the proximal epiphysis of the ulna, where we had the olecranon process, the coronoid process, and then the trochlear notch, which, again, that C-shaped part. As for the radius, we have the radial head, and the radial head really looks like a coin. So if you take a look at it from a superior view, it really just looks like a penny. Okay, it's pretty much the same size of it, depending obviously on the person. Underneath the head, there's the neck. Oh, you know what? I lied. I did not finish the humerus. Remind me to go back and show you one more thing, okay? There is also the radial tuberosity, which I do not believe is on your list. So if anybody has the list, you want to go and check really quick if it's on there. It is? Okay. So we've got a radial tuberosity, and this is where the bicipital tendon is inserted into, and that's why, again, you'll find that these tuberosities, again, are made by the pull of muscles over the years, are going to actually pull the periosteum and, drag the osseous tissue with it, making these different tuberosities. So the radial tuberosity is caused by the insertion of the bicipital tendon. The different joints between the radius and ulna, and these joints are for the movement of pronation and supination. Okay, so the elbow joint is for flexion and extension of the elbow. Pronation and supination are due to these joints between the radius and ulna. There's one that is a proximal joint and a distal joint. The proximal joint we'll see much better in a posterior view, so we'll see that on the next slide. What we can clearly see here are the distal ulnar joint between the two distal parts of the ulna. That membrane between the radius and ulna is known as the interosseous membrane. That is a joint. We usually do not think of membranes as a joint, but joint or articulation by definition is the connection between two bones. That connection could be a membrane. It could be a ligaments and a fibrous capsule like we're kind of used to when we're talking about shoulder and hip joints, or it could just be that membrane. Okay, so this interosseous membrane is a joint connecting the radius and ulna together. Anything anterior to that membrane is part of the anterior compartment of the arm, so that membrane kind of lies right in the middle. I'm not sure how this is showing on your camera, but it's right in the middle of the arm. Anything anterior to it is the anterior compartment of the forearm. Anything behind it is part of the posterior compartment of the forearm. Muscles anterior to that membrane would be flexors, so they would flex either the wrist or the fingers. Anything posterior to that membrane would be extensors. They would cause extension of the wrist and extension of the fingers. Now, let us go to the next slide where we could see the proximal radio-ulnar joint. Okay, so that's really what we want to take from this, from this view right here. Yes, ma'am. Yes, sir.
You said you wanted to show us something before you went on to the next slide on the humerus.
Yeah. I'm gonna that in my head. Thank you.
Okay.
Yeah. I'll finish this and then I'll definitely go back to the humerus. Hopefully, I just remember what I forgot. Okay. I will. It's labeled on there. I'll get it. Okay, but thank you. Yeah, if I go to the next slide, that's when you want to remind me for sure. So on this view, you can see the proximal radio-ulnar joint and the distal, sort of, but again, the proximal is really more apparent on the posterior view. And I don't think there's really anything else on this. These styloid processes, I do not believe, are on your list, so I'm going to just ignore those. And let's go back to the humerus okay, the surgical neck. So on your list, you have that the humerus has two different necks. There's an anatomical neck that is right underneath or, inferior to the head. And then there's another neck, and that is the surgical neck. It's named the surgical neck because that if a fracture is going to happen in the epiphyses or in the proximal epiphysis, it's not going to happen here. Okay, this is too thick of a bone. It's too hard to fracture. But if a fracture is going to happen in the proximal epiphysis, this is the weakest point, and that would obviously need surgery in order to correct that. And that is why it is known as the surgical neck. Okay, so I know I kind of flipped really fast back to the humerus, but any questions on the humerus or on the radius and ulna before we move on? So let me go back to there we go. Any questions on the radius and ulna? Any structures that I might have missed?
Can you repeat what attaches to the radial tuberosity again? Which muscle?
Sure. So the radial tuberosity, the biceps muscle has two insertions. There is a tendon and there is an aponeurosis. The tendon will attach to the radial tuberosity. So one of the insertions of the biceps muscle would be to the radial tuberosity, and that pull of the muscle again is kind of what pulls the bone on it. Are you good, Noah?
Yes, thank you.
Okay, I just saw another message come in. Let me see. Did we cover the olecranon of the ulna? Yes, we did. And that was the upper, let me see if I can get that better view. There we go. It's that process right here. So remember we said the C-shaped part of the upper one was the olecranon, and the one on the top, the bottom was the coronoid. So anything else that I might have missed, folks, or am I, because we are good? Okay. If you see anything that I missed, just let me know. Okay, so here is a much better view. We could have just used this. Okay, so here's a better view of the proximal part of the ulna, and you could clearly see the olecranon on top, the coronoid process on the bottom, and the trochlear notch in the middle. The ulnar tuberosity isn't on your list, so I'm just going to move on. And you just want to be sure you're comfortable with these different articulations and so on. What articulates with? Any questions, folks, or is this too fast? Or are we good at a good pace here?
I think we're going at a good pace.
Okay, perfect. Good pace. Great. So for the bones of the hands, we have these little carpal bones, and those are the bones of the wrist. And luckily enough, you do not need to know them individually by name. So you just want to know that we have 8 of them. They're all together combined, known as your 8 carpal bones. And then we have the 5 metacarpal bones, and those are the bones of the hand. And then the phalanges, and those are the bones of the digit. We have proximal, middle, and distal. Okay, in the thumb, obviously, we are missing the middle, so we only have a proximal and a distal. And that thumb is how you're going to tell if medial from lateral when you're looking at these bones. I mean, if you, for whatever reason, for fun, want to find out which hand we're looking at. Okay, so you guys tell me, which hand is this? Is this the left hand?
Is this the left hand?
Okay, how are you getting that that this is the left hand?
Is it the right because of the radius?
This is the right hand, and I'm wondering because more than one of you said left. I'm just wondering, am I missing something? So how are you getting that? You want to make sure when you're putting something, designating it as right or left, that you want to put everything in the anatomical position. So the anatomical position of the hand would be this. Okay, I have to stand up to show you this. I don't know if I'm going to be showing in the camera or not, but at least you can see my hand. The anatomical position would be this way, where I'm going to try to get the video as much as I can here. Okay, so you're standing, the hands are showing towards the front, so this would be my thumb, not this way. So your hand is anteriorly, and it is in the, I want to say, the supine position. Okay, it's by your arms, or it's by your by the body, so not up here, for example. It's all the way down there. The fingers are fanned away from each other, so you kind of want to think of it as in that position. So trying to think, this actually might be the left now that I think of it.
So yeah, how do you tell if we're looking at it from the dorsal versus the ventral side?
Because of the orientation of these carpal bones, okay, and the styloid processes and stuff like that. Okay, you know what? If it's not on your list, let's just ignore this. How about that? Does that work?
Yeah.
Okay.
Actually, Dr. Delia, so on the first metacarpal, there are two small bones. I remember talking about them back in undergrad. But do we need to know those as well? Because I think maybe that's how you could orient yourself, whether it's the right or the left.
You don't.
Okay.
So whatever is on your list are just, know that these are known as metacarpals. These are phalanges. I don't even think for the phalanges you need to know proximal, middle, and distal either. Just that they're phalanges. So unless I'm wrong and that's what's on you, it is kind of detailed on your list, but I don't believe it is.
Okay.
Okay. Okay, so we're good on the bones of the hand. I just want to make sure that we're on time because we do have the quiz. Okay, so for the triangles or the different boundaries, we didn't go over lab yet with of all the muscles, but on the back, if you're looking here, this would be a shoulder and there would be a deltoid muscle over here. Okay, the deltoid muscle has been removed here in order to see the underlying muscles, and you're looking at the dorsal surface or the back of the scapula. That right here is the spine of the scapula. So you're looking at this view right here, okay? again, when we would be dissecting this, we would flip the cadaver over so that we're looking at the back. You'd have to dissect and reflect the deltoid muscle. And again, there are a couple of muscles that we want to know. No, not a couple, a lot more than a couple. But anyway, so there's a muscle on top of the supraspinatus muscle, a muscle under the spine, and that's nicely named infraspinatus or infraspinatus. You'll find it kind of pronounced either or. And then there are two other muscles. Okay, they're kind of like V-shaped, a Teres Minor and a Teres Major. Remember we said that we have a lot of muscles in the body that are named major and minor, and that the major is always going to be the one carrying the minor. So the major muscle is kind of like an adult carrying the minor or the child. The major muscle, or the Teres Major, is the one that is underneath, so it's inferior, while the minor, Teres Minor muscle is superior. The triceps obviously has 3 heads, and that's where the name comes from, but we've removed 2 of the heads, and we only have the long head of triceps showing right here. And then we have the shaft of the humerus. If you've ever dissected a cadaver, you know that muscles are not perfect, so you would have to kind of manually separate these muscles from each other, and then you would find these 3 different spaces. These 2 spaces up here are called the triangular space and the quadrangular space. While there's a triangle down here, and that's known as the triangular interval. When you guys are looking at this, are the spaces and are these names, are they clear enough? Are they big enough for you to see? They're kind of small on my end.
I think it's
So
just a matter of connecting like the boundaries to the actual muscles on the diagram and seeing how that makes the square.
Yeah, I'm going to go over that. I just want to make sure before I kind of dive in deeper into this. Are you guys able to see or is it too small? That's all I need to know. Like, is the image too small? Can you read it fine, or should I share this in a different way?
I think they're okay to see.
Your guys are fine? Okay. Okay, so like my 4th grader, at school they gave him this like very tiny laptops, and the kid's like, Mom, I think I need glasses. I'm like, no, Habibi, you don't need glasses. You just need a bigger screen. So we hooked it up. He hooked up his laptop to an old screen that we had, but it's much bigger. And now everything's fine. So I was just wondering if it's too small for you guys too. Okay, so back to our boundaries and triangles. So another common mistake that kind of comes up with students would be confusing it. Is this a space or an interval? The spaces are on top, the interval is on the bottom. Okay, we have 2 spaces on the top. That's the triangular space and the quadrangular space. And then the interval on the bottom again is known as your triangular interval. So for each of these different spaces, you want to know the boundaries and you want to know the what is passing through them. Okay, so the contents of these spaces. So we will start off with the first one on here, I believe, is a quadrangular space, which is this. So who would like to take a shot at this and tell me what is the superior border of the quadrangular space?
Go ahead.
Is it the Teres Minor?
Correct. So the Teres Minor, correct. And while you're with us, is this still Tola?
Yeah, that's me.
Okay. Okay, what makes the inferior border?
The Teres Major.
Teres Major. Okay, what about Michaela, do you want to take a try at this? Like, what makes the medial border of the quadrangular space? Michaela, are you with us? Having problems unmuting? Okay, perfect.
Is it working? Okay.
Yeah.
Is it the... I'm not
Right
sure.
there.
Oh. Triceps brachii.
It is the long head of triceps.
Long head.
Okay, it's the long head of triceps. Yeah, you want to be specific on the boundaries because remember we dissected 2 of the 3 heads. Okay, and what is left here and is actually participating in making these boundaries would be only the long head of triceps. So again, up there, Teres Minor, Teres Major, long head of triceps, and then we have this lateral border. So anyone, I saw a couple of hands. Where do these hands go now that I don't see them? I don't know where they went. Noah, go for it. Okay, so what makes the lateral border of the quadrangular space?
Would that be just the posterior side of the humerus? Or is there a
It is
specific
actually,
landmark?
it's a little bit more specific, so it's the surgical neck of the humerus. Okay, so
Oh, okay.
it's at the level, so you are right, it is the shaft of the humerus, but we're at the level of the surgical neck of the humerus. And I'll tell you why that's important, because if there's a fracture at the surgical neck, it would definitely affect the contents of that square, okay? So that's where, you know, the clinical significance of this square lies. That, you know, besides, you know, we don't do this to torture ourselves, and because in anatomy, like, we like squares and stuff, it does have a clinical significance, and that again is that if we break that surgical neck, that would affect the contents of that quadrangular space. So what are the contents? There's a nerve and there are 2 blood vessels, an artery and a vein, and they both have the same name. So the nerve is the axillary nerve. Okay, we're actually right here, right underneath the, we're into the depth of the axillary region, and that nerve is known as the axillary nerve. The artery or the blood vessels are the posterior circumflex humeral vessels. That is the full name, so first, middle, and last. Okay, on the image, you'll see just first and last, or first and middle, whatever. They're the exact same artery. So the posterior circumflex humeral artery and vein. On here, you're really not showing the vein, we're just showing the artery. So again, if anybody fractures the surgical neck, that can lead to the damage of the axillary nerve. It can also lead to bleeding if we rupture these blood vessels. Okay, so are we good on the contents, folks? What are the contents?
Axillary
I know, I'm
nerve
this very
and
boring, redundant person that likes to repeat stuff over and over again. So what are the contents, folks?
the axillary nerve and the posterior circumflex artery and vein.
And vein, correct. Okay, so the next one is going to show us the triangular space that is up here. Okay, any takers that would like to identify the boundaries of the triangular space? Anybody? Let me see. Let me volunteer somebody. Let me volunteer somebody else, Mario. Okay, hold on. Okay, I'm so glad that you're, you know, involved. I want to get everybody else involved here too. Anupam, are you with us?
I understand, doctor.
Thank you. Thank you. Anupam, you're here? Okay, I see you're unmuted.
Yes.
So you want to give it a shot at what are the boundaries of the triangular space?
So the how do I say, the bottom one would be Teres Major,
Okay, perfect.
and the one the right side of the triangle would be with the long head of tricep,
Long head of triceps, okay.
and the mesial side of the triangle would be with the Teres Major.
Well, Teres Major makes the lower boundary.
Oh,
Teres Minor makes the upper boundary. So this is the triangle right here. That little tiny dot, that little tiny white dot that you see in the middle, that is the triangle.
okay.
Okay, so we've got Teres Minor on top, Teres Major on the bottom, and then the long head of triceps laterally. Okay, so we want to use lateral and medial as opposed to right and left, because what might be right on this side could be left on the other side. Okay, so we want to kind of stick to the anatomical terms.
Okay.
Okay, so perfect. So now the contents of that triangle are, since we're in the scapular area, the blood vessel, there's just one blood vessel that's in there, and that is the scapular circumflex blood vessel, so artery and vein. Again, on these images, we usually just show the artery. So the circumflex scapular artery is what passes through that triangular space. Okay, any questions on this space, folks, before we move on? Anyone would like to volunteer for the next space then? The triangular interval. Remember, the one on the bottom is an interval. Any volunteers, or should I volunteer someone? Okay, so I guess I have to volunteer someone. Noah, okay, go for it, Noah.
So I'm trying to think of the direction. So I know the top would be the Teres Major. The lateral or the medial would be the long head of the tricep, and then
Correct?
the lateral, that'd be the radial tuberosity, where the profunda brachii attaches to. Or is that a different?
Okay, so it's just the shaft of the humerus. So in this part, we're not going to be very specific like we were up here where it was at the cervical neck. It's just pretty much the humerus. Remember that the passage of any string-like structure like a nerve or a blood vessel isn't going to lead to a tuberosity. Tuberosities are done because of muscle insertions or origins, so muscle attachments, but blood vessels or anything that's a cord-like structure would lead to a groove or a sulcus in the bone. Okay, so the profunda brachii and the radial nerve, and you bring out such a great point up here. These are the two structures that pass through that triangular interval. We just named those exact same structures that pass in something else, that pass on a groove that was found on the posterior part of the humerus. Now, does anybody remember what the name of that groove is? Looking at the names of the structures, can anybody remember the name of the groove? Yes, sir. Go ahead. Go ahead, Mario.
Is it the radial groove?
It is. It's the radial groove. The radial groove. Correct, Rachel. You're right. So it is the radial groove. And this is how we can kind of start connecting different things together. You know, anatomy is really this big puzzle, and you have to put these little pieces. I'm going to be very honest, like the pieces don't really all fit into place until the end of the course. So you just have to kind of take it one step at a time. But definitely, yes, these same two structures that used to be up here and are branching off and going towards the back of the humerus, they reach the back of the humerus through that triangular interval, and now they cross over or traverse on the posterior aspect of the humerus, making that, digging that sulcus for themselves, named after the nerve. So the radial groove is where the radial nerve, profunda brachii artery pass, and those are the exact same structures that pass through the triangular interval. Okay, is anybody lost or is everybody okay? Any questions? Anybody has a question? Nobody? We're good? Was there a question here? Okay. Okay, so let us move on then. We're an hour in already. I've been talking for a whole hour. Okay. I am going to go ahead and open up the VH dissector, which I don't know why I didn't do that before lab, because it takes some time. And if you want to open up your dissectors too, that would be great. So we could stop sharing, and I'm going to share something else. So let me share this. Share application. And I want this to show. There we are. So everybody should be seeing the VH dissector that I put up right now. And again, I don't really like this part, so I'm going to hide it. And where we are going to find some of the structures that we talked about today, especially the muscles, because those were not on the slides. We want to go to cadaver dissection guide, and then to the upper extremity, and let's do the bones first. And, oh, that's the sternum, okay. That's a clavicle, we did that before. Scapula, we did that as well. There we go, there's our humerus. So it's really cool because you could kind of click on it, it'll highlight the part for you. And these are awesome sources of pictures for the quiz, I'm not gonna lie. Okay, oh, this is being recorded. Okay, maybe I'm just gonna have to edit that out. Okay, but this is, you know, you can highlight these different parts. You can see where the greater tubercle is, lesser tubercle, inner tubercular sulcus or the bicipital groove, and so on. So things that are only on your list, that's what you want to worry about. Okay, looking at the proximal part of the humerus again. Didn't we just do that? Okay. Anterior distal humerus, we have the capitulum, trochlea, the two epicondyles, so you can see the medial and the lateral epicondyle. And what else did we have to know? Radial fossa, I'm not sure if that was on your list or not. If it is, well, there it is, folks. And that's where the head of the radius would be, would live when we flex the elbow. Okay. So this is the posterior view, and you can see the fossa, the olecranon fossa, and I believe that's pretty much, you can still see the epicondyles from the back as well. Okay, now the ulna. Olecranon process, trochlear notch, coronoid process, and there was nothing else that we had to know on there. Radius, we got the head, the neck, and the radial tuberosity. The interosseous border, that's just the border where the interosseous membrane would be attaching to the radius. Okay. And then again, you don't really have to know the individual carpal bones, just want to know that they all exist. Okay, so you can use these images as well. Metacarpals and the phalanges. Okay, so that is it for bones. Now let me figure out where to go from here. Hold on, folks. Okay. Okay, so we're at the muscle area. I'm just going to enlarge that a little bit. So there's the pectoralis major muscle. That is the muscle of the anterior aspect of the chest. In order to find the pectoralis minor, you have to dissect, the pec major. So when you click on it and remove it, there's nothing there. Okay, pec minor, show up for us. Okay, you can see here. On one side, you can still see the pectoralis major. Again, when we usually on the cadavers, we dissect them at the midline. So we would make that midline incision and then reflect it laterally. So we kind of flap it over and you would find the pectoralis minor underneath it. The serratus anterior. So if somebody has the list, was the serratus anterior on your list? Move. Is anybody checking the list?
I am right now. I don't think it is.
You don't think it is? Okay, that's even better. Okay. Biceps is?
The bicep is, yeah.
Okay. So here we have your biceps muscle. I'm going to have to say, honestly, like this picture looks like a very funny biceps. This is not what the biceps really looks like, but structures 1. Okay, so this is a real pectoralis major muscle. That is a deltoid muscle, and you can see how all of the fibers kind of, gather together and insert into that part of the bone, the deltoid tuberosity of the humerus. Let's go over these. These look good. Yes, something that really I want to show you. Okay, when you reflect the pectoralis major, underneath it, you can find the pectoralis minor. And these two nerves right here are your lateral and medial pectoral nerves. So try to orient yourself what you're looking at. Okay, so let's zoom out a little bit. So that is the neck. This is the arm. We're calling this the lateral pectoral nerve, while this is the medial pectoral nerve. Is anybody seeing anything wrong with this?
Isn't it because technically when the pectoralis major is flipped back down, the medial is closer to the neck while the lateral is farther away? Like right now we're looking at it kind of backwards since the pectoralis major is flipped out.
Okay, so that is one thing. The only thing is that when on the test, we are going to be seeing this image right here. Okay, so you are going to be seeing it reflected, or you'll see it maybe with the pec major not even there.
Mm-hmm.
So when you're looking at it, they are still look like they're not oriented correctly. They are also, if you guys remember, that the lateral and medial pectoral nerves were named according to their origins, where they originated from in the brachial plexus. So remember, the lateral pectoral nerve was a branch of the lateral cord, and the medial pectoral nerve was a branch of the medial cord. So at one time, when these nerves were originating in the axillary area, their orientations were right, okay, were correct. But when they get to this more superficial structures, they tend to change their orientation a little bit. And as you said, again, I'm not really sure who said that, but as you guys mentioned, that because of the reflection of the pectoralis major, we are seeing them in a different orientation. So another common thing that kind of, students confuse are these two nerves. So looking at them, both of these nerves end in the pectoralis major. So they both innervate the pectoralis major muscle. And you can see them. Let me, if I could zoom in here a little bit. You can see both of them ending in the pec major. One of them, though, perforates the pectoralis minor muscle. So you see it here coming from, perforating the muscle from deep to superficial, and then ending in the pec major. That is the medial pectoral nerve. The lateral pectoral nerve appears above or superior to the pectoralis minor muscle, and then it ends in the pec major. Okay, so there are a couple of different ways to remember. Either just flip the names, okay? So although this looks like it's medial, but it's actually the lateral pectoral nerve. And although this looks like it's lateral, but in reality, it's the medial pectoral nerve. Or you could do the anatomical, the more scientifically correct way of knowing that the nerve that perforates the pec minor and ends in pec major would be your medial pectoral. And the nerve that appears superior to the pec minor is the lateral pectoral nerve. Okay, again, both of them end up in the pec major muscle. Okay, so are we good on that, folks? Let me go back to where you guys are. Any questions, friends? We're all good?
Yep.
I'm good.
Okay. Okay. You're good. Awesome. Okay, thank you. That makes me feel so much better knowing that we're good on different points. Okay, okay. So what is next on the, what do they have for us here? Kind of the same thing, but the nice thing that they're not named. So who would like to name that nerve for us then? Yes, Tala.
Is that the medial pectoral nerve?
That is the medial pectoral nerve, correct. Okay, what about, well, we have no other options at this point. Where is it? So that nerve right here. That is obviously the lateral pectoral, okay? So that is an important point I wanted to make out today, so I'm glad that came up. I am going to the artery that is kind of in close proximity to the lateral pectoral nerve would be the thoracoacromial artery. I think I'm just going to move on from that. No artery. This is the serratus anterior muscle. Oh, did you guys mention that it's not on the list? Or was it? We're not
Yeah,
sure?
it's not on the list.
It's not? Okay. Then we shall move on. Or was it there from last week? I don't remember. This right here is a whole big mess of ropes. Okay. But the muscles are fine. So we could use that. So that right here is your biceps muscle, and that is the coracobrachialis muscle underneath it. The coracobrachialis is deep to the biceps, so in order to find it, you would have to remove the two heads of biceps, and then underneath it, you could find the coracobrachialis. So looking at that, you can see the coracobrachialis deep and the biceps muscle up here. Where are my arrows? Step here. I'm going to move on from this because that is a lot going on and not the best things that we would be using. So I've got some other pictures for you folks, so don't worry. Here again, you can see your biceps and the coracobrachialis muscle. Something that is very clear on this one, though, is that nerve that is entering into the coracobrachialis. Okay, the nerve that is a branch from the lateral cord and enters into the coracobrachialis muscle is the musculocutaneous nerve. Okay, so that's something that you want to definitely keep in mind. You could be asked, like, what is this nerve? What is the muscle? What is that cord right here? So you kind of would have, it'll be more than one step. So you would hope, think to yourself, so the nerve entering to the coracobrachialis is the musculocutaneous nerve. That means that this has to be the lateral cord. Okay, so that is kind of like your process of thought as this goes. Too much going on here. Okay, so these are a couple of things that I wanted to show you. There's one more thing, and I think that's the quiz. So for the quiz for today, because I know that the brachial plexus is not one of the most friendly topics, so what we are going to do is we are going to review and quiz at the same time. Okay, so it's kind of like a very friendly quiz. It's more of a group project.
That sounds great.
Okay, so let's do this. And how do I unshare now? Why am I confused? Stop sharing, and then oh, I remember now. Hold on. Brachial plexus arm quiz. Is this? Yep. So I'm gonna share this. You see, that's what happens when you're, most of the time I don't have everything uploaded to the session like I do today, because these are the things that I used yesterday, so I just kept them from last morning. And I'm looking for them everywhere on the computer except for where they actually are. Okay, so again, can you see these pictures? like well enough where you could. Okay, it must be my old last. What?
They're a little bit.
Yeah,
I
can
think
you
they're
zoom in a
small.
little bit, maybe?
Yeah.
Okay, or I don't. Oh, make any difference on what you guys see when I zoomed in like that?
Nope.
No. Okay, let me
Maybe we
Let me
have
share.
to zoom in. Oh, I think we can zoom in. Yeah, I just zoomed in on my screen.
So how do you do it? Is it that little?
So there's a little thing at the top left. If you go, it's like a page with a magnifying glass. If you click on it, you
Okay, I
can.
think I just stopped sharing it for a minute because I think I know where you are, what you're talking about. So I want to show it to everybody. So I'm just going to share my whole screen for a second here. Okay, so it's this, right?
Mm-hmm.
You guys can get out of that Twilight Zone thing, and then you could just zoom in and out, right?
Correct.
Okay.
Yeah.
So let me go back, stop sharing this. You just double clicked on it and zoomed in. Okay, we're all learning things as we go, folks. Seriously. Upper lab material, the arm quiz. There we go. And okay, let me see. I need to zoom in too because I seriously cannot see this. There we go. Okay, so again, take a first second or two and orient yourself where you are in the body. So we have here, yeah, like I said, I'm learning so much about technology this semester that it's unbelievable. And I'm learning for the students. I'm learning for my kids. It's great. I just wish that I don't have to use computers as much anymore. Like I enjoyed them, but they used to be fun. No longer so. Okay, so this again is the chest area. Again, on that question on the exam or anywhere you wanna, or on the quiz, take 1 to 2 seconds and orient yourself. So this right here is the chest area. You know that because that's the aorta. It's huge. We have all of these different branches. So that right here is the Brachiocephalic Trunk. Okay, and you can see the Brachiocephalic Trunk dividing into or splitting into the right common carotid and the right subclavian. For common carotids and subclavian, you want to be very specific if we're on the right or the left side, just because they have different origins. And then we have this tube coming out, and that is the left common carotid and the left subclavian. Okay, you can see the trachea, so those cartilaginous rings that you're looking at, that's the trachea. I know it's not on your list, but I'm just kind of go over certain things. And then the left, that's the right subclavian, as it goes behind, inferior to the clavicle. The clavicle has been removed, and that's why we're seeing all of these structures. You can see now some of the branches of the subclavian. So that right here is your thyrocervical trunk with the branches coming out. So suprascapular artery, and that artery right here is your transverse cervical artery. Okay, the transverse cervical artery is, okay, I'm not a dentist, so maybe I don't understand the clinical or don't appreciate the clinical significance, but it's a very common thing to ask about the transverse cervical artery. So the dentists in the lab really like that artery, okay? Now, another artery to look at going down, that is your internal thoracic artery, okay? So I'm going to send this all to you folks when we're done with lab, just like every week. But take a look at this because the next one is when we're going to start the quiz. So let me know when you are ready. And okay, so I'm going to go in order, in alphabetical order. Where did my pencil go? Okay, so Anupam, what is structure number 1, 2, and 3?
1 is Brachiocephalic Trunk.
Correct?
Then 2 is Subclavian Artery.
You want to be specific on the subclavian. So is this right or left?
Mm, I'll go with right.
So hold on, we're on number 2, correct? Okay,
Yeah.
think again. Remember, your right is the patient's left.
Oh yeah.
Okay, so it's crisscross as to what your sides are.
Okay, then it should be left.
Left, correct. So the heart would be right here. Here in this area.
Okay. The number 3 is internal thoracic.
Number 3 is your internal thoracic, correct. So you are good. Stay with us. When I say you're good, doesn't mean you're good to go. You're like,
Yeah.
you're good on their quiz. Okay. Okay. So Haun, how about we go over 4, 5, and 6?
Is for the right subclavian artery.
Correct.
And then 5 is the transverse cervical,
Yep.
right transverse cervical artery, and 6 is the suprascapular artery.
Suprascapular artery, correct. Yep. Michaela? Oh, hold on. We have to go to the next image, don't we? So let's go over the next one. Now, here, what, again, are we looking at? You could see the clavicle. Okay, and it's kind of kept there so you can orient yourself as to what we're looking at here. That is the subclavian artery, so that huge blood vessel in the back is the subclavian, and you can see a couple of the branches count. So again, that infamous transverse cervical artery and the suprascapular artery. So these are the exact same 2 structures that we were looking at over here. Okay, it's pretty much a zoom in. So that is your transverse cervical and suprascapular, and that was the trunk. So that is just a zoom in on what we were looking in the other side. Looking at in the other side. Oh, Michaela, are you ready?
Yes.
Okay. So structures number 7 and 8.
7 is the transverse cervical artery, and 8 is the suprascapular artery.
Correct. Okay, so Mario, you were already good. I promised that if you answer that one question, you wouldn't have to answer anymore.
I can go too, but you
want to take the?
You could do me last.
Okay. So, Michael, before again, I ask you for orientation. That's the clavicle. That right here is subclavian, and then you've got these little branches that are coming out. You have the one medially, that's the thoracoacromial artery, and then the other one, hold on, I'm just looking at something else, and that's why I am totally, hold on, I'll come back to you folks, just give me a second. Okay, sorry about that. Okay, so again, your thoracoacromial artery and lateral thoracic arteries. Okay, so these are the 2 arteries coming out of that big artery known as the subclavian. Okay, so who was it? Michael. Michael, are you ready?
Yeah.
Okay. 9 and number 10.
So is number 9 the thoracoacromial artery, and then
Mhm.
10 is the lateral thoracic artery?
Correct. And, one good way to know is, well, you know what? Delete that. There is no good way. Just figure it out. Okay. There really is no good way to know this, especially that we're really zoomed in. Something like this, we'd really have to zoom out a little bit so you can really tell medial from lateral. At least, we want to show you maybe the sternum here so you could figure out that this is medial and that is lateral. Okay. So if we do have that orientation, well, you could know that that is the thoracoacromial artery, while on the lateral side is your lateral thoracic artery. That's really what I was trying to go for. But looking at the image as it is right now, it's very hard to tell medial from lateral.
Is that the clavicle?
Okay, you are definitely correct. Yes, sir.
Okay, thank you.
Oh, okay. So we're good? So we already went through this one. Where are the Really? You would do that to me? Okay. So these right here, can anybody guess what those are? I thought there was one that had them. Isn't this supposed to be the key that I'm sharing with you folks here? Let me see. Who raised their hand first?
Are those the branches of the brachial plexus?
Not the branches. So you're very close. Okay, so Said.
Number 11 is C5, 12 is C6, 13 is C7, 14 is C8, and 15 is T1. And 16 is superior, 17 is middle, and 18 is inferior.
Okay, so yes, so just one thing that I wanted to comment on, as you're saying, you are definitely right. So these are C5 through T8. You want to make sure that you are saying that these are, the roots of the spinal, spinal roots, or the, when I say C spine, or the dorsal root of C5, the dorsal root of C6, and so on. You want to just be a little bit more specific, but you're definitely right. These are C5, 6, and 8, and T1. These are your dorsal rami of those spinal nerves. Okay, so I know that somebody else, so Said, you're good. There was somebody else that had their hand up, and I'm not sure who it was.
It was me.
Was it Rachel? I think it actually was Rachel. Okay, so Rachel, how about, are you ready for 16, 17, and 18?
Yeah, I think you already answered them, but we can go for it.
Okay.
So 16 is the upper trunk, 17 is the middle trunk, and 18 is the lower or inferior.
Right. The
trunk.
lower trunk, I'm pretty not like the best way, because you could still, they still look like they're two. They haven't combined yet. They would combine behind that clavicle. But C6 is very clear that it's the upper trunk. 7 is really clear. It's pretty much the continuation of C7. Okay, so that's definitely your middle trunk. And then these two would combine together to make your lower trunk. Okay, perfect. No, ready for the next one, folks? Here goes nothing. Okay, so for orientation, this huge blood vessel, who would like to take, a try at 19, 20, and 21? I'll leave it up there for a moment. Rachel, you want to go ahead. Let's give it a try.
Okay, so 19 is a cord, so it's a medial cord. 20 is the lateral cord. 21 is a musculocutaneous nerve.
Correct. Yep.
Going.
Oh, no, I think that's all I said. Yes. So you're absolutely correct. So 19 is your medial cord. 20 is the lateral cord. And 21, because that nerve is going into the coracobrachialis muscle, so that is your musculocutaneous nerve. That is correct. Okay, perfect. I realize this is a hard one, so that was awesome. Anybody else had their hands up here? No? Okay. 20, we did 21, right? So 22, 23, and 24. Go for it, Tala.
So is 22 the median nerve and 23 the ulnar nerve? And is 24 trying to be the inferior trunk?
It is not a trunk. So you can see branching out of it, it is a blood vessel. Remember, there is a blood vessel that these cords are named according to relationship to that blood vessel.
I'm not sure.
Okay, any takers, folks? Yes, Noah.
It's not the brachiocephalic, is it? The brachiocephalic
It's not brachiocephalic.
artery. Okay.
I am in a meeting, yes. Okay. Yes, Rachel.
The brachial artery.
It is the brachial artery, correct. So that is the brachial artery. These are the cords in relationship to that artery. And then remember the M-shaped brachial plexus. That is how we identify these three structures. So that right here is the musculocutaneous, that is the median nerve, and 23 is your ulnar nerve. These are the origins of that median nerve with an N. Remember we had like a lateral portion and a medial portion coming from their corresponding cords. Can you shut the door, please? Sorry, minor interruption. I have a helper here, an assistant. Oh, sure. Okay, just shut the door, please. Okay, so my son is taking a quiz and he wants me to be quieter. So cute. Okay, I didn't realize I was that loud anyway. Anyway, so are we all good with these different parts? So brachial artery, lateral cord, medial cord, giving out these two branches, median nerve, ulnar nerve, musculocutaneous nerve. Tell him we're taking one to, you know what? I should have told him that. Yeah, like his quiz is so cute. Like, what are the different kinds of energy that you could feel? What are the different kinds of energy that you cannot feel? What else? Like, she literally gave him the quiz. Okay, now that I said that, it's kind of like what I'm doing right here. Ask him if he could swap. You have no idea what those are. Honestly, I think I either when I, but anyway, let's get back to anatomy. We have like 25 minutes. I gotta get this all done. Want to make sure we go over these. Okay, so this right here, when you're looking at this, what we've done is that we've removed the brachial artery. We removed the other cords, so the anterior, or not the anterior, the lateral and the medial cords. And what you can see here is the posterior cord with its branch. So what looks like the continuation of the posterior cord is your radial nerve. And that right here is the axillary nerve. Okay, you can see another branch, that is the thoracodorsal nerve. Okay, so let's, take a close look at that before we switch. There's one more nerve that you now want to know. That's the subscapular nerve. Is it on there? Yep. So the subscapular nerve. Orient yourself as where on earth are we looking at? That is the Serratus Anterior, so this is the trunk. Okay, we've removed again the clavicle, we removed the Pectoralis Major and Minor and so on, so that we even removed the brachial artery and the other, all of the rest of the other nerves, so the lateral and medial cords. Okay, so are we good on this one before we flip to the actual quiz? Let me see who did not answer so far. I think he pretty much already answered. Okay, so here goes. Okay, so Noah, do you have a question or do you want to answer? Noah.
I was going to answer. I actually don't think I went. So 25 is going to be the posterior.
Posterior what?
Cord.
Trunk or cord? Cord, correct. Yep.
Yeah, cord. 26 is going to be the axillary cord, and then 27 is the radial. Correct. And 29 would be the subscapular nerve, and then 28 would be the thoracodorsal nerve.
Yes, sir, you are absolutely correct. Okay, now remember that radial nerve is going to pass through a space and then get to the back of the arm and it make that groove on the humerus. Okay, I know I'm very repetitive, I'm very boring. But again, if you have all of that in mind and are able to make that mental map of these structures, that would be awesome. Okay, so perfect. No, I got your name down. Next slide here. Suprascapular nerve. I don't think you have enough info to be able to identify the suprascapular nerve. So me going to move on. This right here, these are all different veins, and we know that they're veins because they are darker in color. Okay, the arteries, as you can see here, they used to have oxygenated blood, and because they have a very thick wall, you could see them more brighter than the veins. The veins used to have deoxygenated blood. Their walls are much thinner, and as blood post-mortem, the blood is going to clot, and you could see that it'll clot in the veins. You could see, or either or, but when they do clot in the veins, you'll be able to see that more darker bluish color of veins, and that's how you identify veins. You distinguish the vein from an artery. What you are seeing down here, that is the superior vena cava, and these two veins unite. The right and the left brachiocephalic veins unite to become the superior vena cava. And the brachiocephalic vein, each one of them is made out of a subclavian vein and an internal jugular vein. Remember, venous drainage is going towards the heart, so the blood would really be flowing in this direction. So subclavian, internal jugular, they unite to become the brachiocephalic, and then these two brachiocephalics combine to become the superior vena cava, and that would dump all of that deoxygenated blood into the right atrium. Okay, so is everybody good? We can move on to the next slide. Okay.
Dr. Dahlia.
Yes, sir.
How is this picture oriented? Like, how are we looking at this? I'm a little bit confused.
Okay, so it's the front of the neck. Okay, we've removed the sternum. That is the thymus gland. That would be right here in the front of the neck. You could see.
Oh, I see it. Yes. Okay.
You got it?
Yeah, I think I got it now.
Okay.
Thank you.
No problem. Did anybody else have any other questions, or are we all ready? Okay, so any takers on this? Who would like to do that? Michaela, go for it.
Number 31 is the SVC. Number 32 is the left brachiocephalic vein.
Correct.
33 is the left SVC. And then 34 is the right brachiocephalic vein. And 35 is the right subclavian vein.
Okay, so I'm just going to go back to 33, okay? So that is the left subclavian.
Okay, oh yes.
Okay, the SVC is the superior vena cava. It's all the way down here. We don't have a right and left of those. There's just one of them.
Okay.
Okay, so are we good on this, folks? Okay, so ready for the next one? We already saw this one before, but what is extra here? Okay, the thyrocervical trunk. Okay, so we did not see that, or did we? I don't remember. But anyway, the thyrocervical trunk would come out of the subclavian, giving these two branches that we identified before as the transverse cervical and your suprascapular. So remember the one that we saw. Is there a faster way to go all the way back? I guess not. Thyrocervical trunk, giving that transverse cervical and the suprascapular artery. So there you go. Okay, so this is kind of like a little bit more zoomed in where you can see the thyrocervical trunk, suprascapular, and transverse cervical arteries. Okay, so I think we already went through all of the, the rest of these blood vessels. So we will move on to slide 16. And any takers on this one? Any brave souls that would like to try this? Go ahead, Noah.
So 36, the brachiocephalic artery. 37 would be the that would be the right. I lost it. Sorry.
No,
I know
that's
39 is
okay.
the axillary artery, I think, and then 38 is the Skip me. Sorry.
Thyrocervical, you're doing great. No, you're fine. Okay, so anybody else would like to take over then?
I think 37 is the right subclavian artery, and then
Correct?
40 is the left subclavian artery.
40 you said? Correct. Left subclavian. Yep. Okay. So so this right here, that's your Brachiocephalic trunk. Okay, remember it will divide into the right subclavian that will change into number 39, the axillary. And brachiocephalic will give out also the right common carotid. Okay, so there's no number on here, but that is the right common carotid artery. Okay, so next. Again, we would have to zoom out a little bit more because and to figure out where we're at in the body. I know where we are because of the labels. But in reality, we have to be zoomed out or somewhere to tell you that you're in the axillary area. But you can see these little two branches here, the anterior and the posterior circumflex humeral arteries. And those are two arteries that literally hug the upper part of the shaft of the humerus. They are going to anastomose, and an anastomosis would be where two arteries, or arterioles, I should say, I guess, meet each other. And so we usually talk about how the blood vessels go arterial, capillary, and then venule. In these anastomosis, it goes arterial, capillary, and then arterial again, because these are blood vessels that are connecting together in order to add more blood supply to the shoulder joint. So you'll find that bigger joints would have a lot of anastomotic blood vessels, so around the shoulder joint and the elbow joint and so on. So these anterior and posterior circumflex humeral arteries, again, they hug the upper part of the humerus and they anastomose together. And then we also have that subscapular artery. Okay, again, something like this would have to somehow tell you that this is in the axillary region. Okay, but I'm just going to show you the next one and in order to go over that one more time. So here again, does anybody want to try this or should I just keep on going? Mario, go for it. So 41.
Yep, that's the subscapular artery.
Mm-hmm.
42 is the posterior circumflex artery. And then 43 is the anterior circumflex.
Correct. So you are good to go. Not go as in leave, you know what I mean. Okay.
Yes.
The veins. So these again are the bluish veins that we have. You can see here the cephalic vein, and one of the best ways to identify the cephalic vein would be that it's at the lower border of the deltoid muscle. So you can, this one is very oriented. You can clearly see that that's the clavicle. This is the shoulder region. That is the deltoid muscle. The vein that would be at the inferior border of the deltoid muscle is your cephalic vein. Okay, it will dump all of that deoxygenated blood into the subclavian vein. So we are going to go on to any takers on these two veins? Somebody that maybe did not. Anupam, go for it.
So I think number 44 is right subclavian vein.
Correct.
And 45 is cephalic vein.
The cephalic vein, correct. Remember when you're identifying blood vessels that you definitely have to say vein or artery. Okay, because that would be part, if it's fill in the blanks, again, I'm not really sure how it's going to be, but even if it's multiple choice, you could be getting subclavian artery and subclavian vein as two different choices, and you're just kind of going fast and you want to, you know it's a subclavian, but you pick the subclavian artery, so you've just lost that point. Again, so you want to kind of pay attention to reading the whole question or all of the answer options. Okay, so, okay, somebody correct that spelling. Okay, it's a basilic with an I. But this is the elbow region, And you can see the cephalic vein and the basilic vein. And then the vein that connects them both together is the median cubital vein, or MCV, median cubital vein. So we are going to go to the next one. Would anybody like to volunteer and tell us which 3 veins those are? Okay, Michaela, it's all yours.
Number 46 is the basilic vein, 47 is the cephalic vein, and 48 is the median cubital vein.
Okay, perfect. Thank you. Now, last but not least, there's nothing. What is this? Okay, let me just double check and make sure there really is it is just a blank slide. Okay. Okay, so there you have it, folks. We finished our brachial. No, I'm gonna lie again. Hold on. I just want to show you the videos. We did not watch the videos together, but I'm pretty sure you guys can watch that on your own. You don't need me here. While you're watching. Share application. Now, where is it? There we go. So you're seeing my blackboard right now, correct?
Yeah.
Okay, so arm and shoulder, that's what we did today. And there are several videos, okay, that you could watch. Again, I'd rather that we discuss things together and then you guys watch the videos on your own time, unless we have enough time to watch it together, which we didn't today. So make sure that you do not forget about them. Go back in and take a look at them. And let me know if you have any questions about them. So you can see here, for example, just the first minute, because the rest of the muscles on there are things that you are not assigned to you guys, okay? And these are the slides that I used at the very beginning of today's lab. So with that being said, any questions for me, folks? If not, then you guys enjoy the rest of your Tuesday. I will see you next Tuesday, folks. Bye-bye.
Thank you so much, Dr. Delia. I'll see you next Tuesday.
Thank you.
Thank you.
Thank you, folks. I'm going to post this and send you, you love the tip. Well, thank you, Tola. Okay, thought nobody would notice. I'm just, thanks. I appreciate it. This is like the cleanest spot in the house for now. I just cleaned this one little spot in order to be presentable when I'm on here. Everything else is a total disaster. Okay, so I'll see you next week, folks.